Point number 1. Understand the nursing process, assess, diagnose, plan, implement, evaluate. Point number 2. Prioritize patient safety above all interventions. Point number 3. Use ABC priority: airway, breathing, and circulation. Point number 4. Apply Maslow's hierarchy to set nursing priorities. Point number 5. Know normal vital signs for adults and children. Point number 6. Memorize common lab values such as electrolytes, CBC, BUN, and creatinine. Point number 7. Follow standard precautions and infection control measures. Point number 8. Identify early sign of infection including fever, redness, and swelling. Point number 9. Practice effective hand hygiene before and after patient contact. Point number 10. Understand sterile technique for invasive procedures. Point number 11. Recognize and manage the different type of shock: hypovolemic, septic, and anaphylactic. Point number 12. Follow the 6 rights of medication administration. Point number 13. Monitor for adverse drug reaction and allergies. Point number 14. Calculate medication dosage accurately. Point number 15. Educate patients about common medication side effects. Point number 17. Implement non-pharmacologic pain relief techniques. Point number 18. Understand acid-base balance and arterial blood gas interpretation. Point number 19. Identify fluid and electrolyte imbalances. Point number 20. Manage IV therapy safely and prevent infiltration. Point number 21. Monitor for sign of hyperkalemia and hypokalemia. Point number 22. Assess basic cardiac rhythms and recognize ECG changes. Point number 23. Recognize early sign of heart failure. Point number 24. Understand diabetes management and different insulin types. Point number 25. Prevent complications of hypoglycemia and hyperglycemia. Point number 26. Implement fall prevention strategies. Point number 27. Identify pressure injury stages and method of prevention. Point number 28. Perform neurological assessment including level of consciousness and pupil reaction. Question number 29. Monitor for increase in intracranial pressure. Point number 30. Understand respiratory disorders such as asthma, COPD, and pneumonia. Point number 31. Perform proper suctioning technique. Point number 32. Administer oxygen safety and monitor oxygen saturation. Point number 33. Educate patients on correct inhaler and nebulizer use. Point number 34. Understand a renal disorder and provide dialysis care. Point number 35. Assess urine output and note abnormal characteristics. Point number 36. Provide postoperative care and prevent complication. Point number 37. Recognize sign of infection at surgical sites. Point number 38. Provide culturally sensitive and respectful care. Point number 39. Communicate effectively with patients and the healthcare team. Point number 40. Maintain confidentiality and follow privacy regulations. Point number 41. Identify legal and ethical issues in nursing practice. Point number 42. Understand delegation principles and scope of practice. Point number 43. Provide end of life and palliative care. Point number 44. Recognize sign of abuse and follow reporting protocols. Point number 45. Support mental health need and maintain suicide precautions. Point number 46. Provide effective patient education and discharge planning. Point number 47. Use evidence-based practice for clinical decision making. Point number 49. Keep current with continuing education and licensure requirements. Point number 50. Practice self-care and stress management to prevent burnout.